Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
We're diving into a topic today that honestly is pretty unsettling. It's the alarming rise of children being exposed to fentanyl.
Yeah,
You might think this is just about teenagers experimenting with drugs,
right.
but the reality is far more disturbing. We're talking about young children,
Yeah.
even toddlers, accidentally ingesting this incredibly dangerous substance.
It's scary.
In fact, there's been a nearly tenfold increase in fentanyl exposures among kids under 12 between 2015 and 2023.
Wow.
To help us understand what's going on, we're taking a deep dive into a recent study published in the American Journal of Drug and Alcohol Abuse,
Okay.
along with some related reporting from Medical Express.
It really is a frightening trend. And what's particularly concerning is that it's not just a simple increase in numbers.
Right.
The nature of these exposures is changing too.
That's what caught my eye as well. So
Yeah.
let's break down this study. What were the researchers looking at specifically?
They focused on non-fatal fentanyl exposures in children aged 0 to 19, pulling data from poison centers all across the United States.
Interesting.
What's interesting is they split the kids into two groups,
Okay.
0 to 12
Uh-huh.
and 13 to 19.
Okay.
And found some pretty stark differences in how those groups were being exposed.
Okay, so what's the difference?
Well, with the younger kids,
Yeah.
it's primarily unintentional exposures. They're finding pills, patches, or other forms of fentanyl and
love that.
accidentally ingesting it.
Oh.
But with the teenagers, it's more often a case of misuse or abuse.
Okay.
Although even within that group, there are some important nuances.
So we're seeing a mix of accidental exposure in young children and intentional use, sometimes with unintended consequences among teens.
Exactly. And that's where the real concern lies.
Right.
Because the study found that almost 45% of fentanyl exposures in 2023 were life-threatening.
Wow.
That's a dramatic increase from just 16% back in 2015.
Wow, those numbers are really scary.
Yeah.
And when you consider how much more sensitive young children's bodies are to fentanyl,
Right.
even a tiny amount can have devastating effects.
Absolutely. The speed at which fentanyl can impact a small child is terrifying.
Yeah.
And the study highlights how the ways children are being exposed have shifted over time.
Oh, so.
In the early part of the study, dermal exposure,
Okay.
mainly from fentanyl patches, was a major concern.
Right.
But by 2023, ingestion, primarily of pills, had become the most common route,
Right.
especially for younger children.
That makes sense considering what we're hearing about counterfeit pills flooding the market. The Medical Express article mentioned how these pills are designed to look just like regular prescription medications, things like oxycodone, Xanax, or Adderall.
Yeah, it's scary.
Teens, especially, might have no idea they're actually taking fentanyl.
That's a huge problem. It's no longer just about keeping your own prescriptions safely locked away. It's about this hidden danger of disguised pills circulating among teens. It's incredibly dangerous because someone might think they're getting one thing,
Right.
but end up with a potentially lethal dose of fentanyl.
It's terrifying to think about. And what's even more disturbing is how easily this can happen. You mentioned earlier that even young children are getting exposed to fentanyl.
Right.
What are the typical scenarios there?
Sadly, it often comes down to simple curiosity.
Uh-huh.
A child might find a pill on the floor,
Right.
think it's candy, and swallow it. Or they might stumble upon a patch that's fallen off someone and put it in their mouth.
It seems like parents and caregivers need to be incredibly vigilant, even about things they might not normally consider dangerous.
Absolutely. And that's why safe storage of any medication,
Right.
whether it's prescription or over-the-counter, is so crucial.
Yeah.
You really have to keep these things completely out of reach of curious little hands. Even if you think your child wouldn't be interested, it's better to err on the side of caution.
I think many parents, myself included, tend to focus on keeping medications out of reach when kids are very young,
Right.
but then relax a bit as they get older.
Mm.
It sounds like with fentanyl, we need to maintain that vigilance through the teenage years as well.
That's a great point. The teen years bring a whole new set of challenges because they're more likely to be experimenting with substances
Right.
or obtaining medications from friends or online sources.
And that ties in with the counterfeit pill problem we were talking about earlier.
Exactly. Teens might think they're getting a harmless pill, but it could be laced with fentanyl without their knowledge.
It feels like we're fighting a losing battle. when you consider how readily available these counterfeit pills seem to be.
It's certainly a daunting challenge,
Yeah.
but that's precisely why awareness and education are so vital.
Right.
We need to be having open and honest conversations with teens about the dangers of these pills
Yeah.
and the importance of only taking medications prescribed by a doctor.
So what are some of the key things parents and caregivers can do to start these conversations?
First and foremost, it's about creating a safe space for open dialogue.
Huh.
Teens need to feel like they can come to you with questions or concerns without fear of judgment.
That's easier said than done for some families, right?
It definitely can be. But it's so important to try to establish that trust early on.
Right.
Let your kids know that you're there for them no matter what.
Beyond creating a safe space for conversation, are there any specific topics we should be addressing with our teens?
It's crucial to talk about the dangers of counterfeit pills specifically.
Yeah.
Explain that even pills that look identical to legitimate medications can be laced with fentanyl,
Right.
which can be deadly even in tiny amounts.
And it's not just about pills, right? Fentanyl can be found in other forms as well.
That's right. It can be in powders, liquids, even nasal sprays. So the message needs to be broad. Never take any substance unless you know exactly what it is and where it came from.
And it sounds like we need to go beyond just warnings.
Right.
We need to give our teens practical advice on how to stay safe.
Absolutely.
Oh, like what?
Things like never taking a pill that wasn't prescribed to them, never sharing medication with others,
Right.
and being aware of the signs of an opioid overdose.
That last one seems especially important. Could you go into more detail about the signs of an opioid overdose?
Of course. Some of the most common signs include slow or shallow breathing,
Okay.
pinpoint pupils,
Okay.
confusion,
Yeah.
drowsiness, or loss of consciousness.
It's scary to think that a child could be overdosing and we might not even recognize the signs.
That's why it's so important to be informed.
Right.
And it's also crucial to know what to do in case of an overdose.
Which is?
Call 911 immediately, and if available, administer naloxone, also known as Narcan,
Right.
which is a medication that can reverse the effects of an opioid overdose.
Naloxone, that's something we hear about a lot these days. Where can parents and caregivers get access to it?
In many states, you can purchase naloxone over the counter at pharmacies without a prescription.
Okay.
You can also check with your local health department or community organizations to see if they offer free or low-cost naloxone distribution programs.
That's great to know. It sounds like having naloxone on hand is just as important as having a first aid kit.
I completely agree. It's a simple step that can potentially save a life.
All of this is such vital information. It's clear that we can't afford to be complacent when it comes to fentanyl.
No.
We need to be proactive in educating ourselves and our loved ones about the risks
Absolutely.
and taking steps to protect ourselves.
You're absolutely right. This is a public health crisis that demands our attention,
Yes.
and we all have a role to play in preventing tragedies.
I couldn't agree more.
Uh-huh.
So as we move forward in our discussion, let's shift gears a bit and explore some of the broader implications of this study's findings.
Okay.
One thing that particularly struck me was the mention of geographic variations in fentanyl exposures. The study found that they were most common in the West, which I found intriguing,
Yeah.
considering that fentanyl use is a nationwide problem.
Right.
Can you shed some light on what might be driving these regional differences?
That's a fascinating aspect of the study, and it
Sure.
highlights how complex this issue really is.
Yeah.
There are a few possible explanations for these regional variations. One factor could be the rise of fentanyl-laced pills,
Okay.
which seems to be more prevalent in certain areas, particularly in the West.
Right.
Another interesting point is that the way fentanyl is being used
Right.
also varies across regions.
Oh, interesting.
For example, smoking fentanyl, often as a way to avoid the risks associated with injection,
Okay.
appears to be more common in some areas, and this might actually be linked to fewer life-threatening incidents, which is definitely something to consider.
That's fascinating. It sounds like the way fentanyl is being used can have a significant impact on the severity of the consequences.
Absolutely. It underscores the importance of understanding the specific patterns of use in different regions
Right.
and tailoring harm reduction strategies accordingly.
So it's not a one-size-fits-all approach.
Exactly. What works in one community might not be effective in another. We need to be flexible and adaptable in our approach to addressing this crisis.
It makes me wonder if there are any specific examples of successful harm reduction strategies that we can learn from.
There are actually some very promising initiatives underway in various parts of the country. One example is the increasing availability of fentanyl test strips,
Okay.
which allow people to check whether a substance contains fentanyl before they use it.
Wow.
This can be a life-saving tool, especially for those who might unknowingly be consuming fentanyl-laced drugs.
That sounds incredibly valuable. Are there any other examples you can share?
Another important development is the expansion of needle exchange programs
Okay.
and supervised consumption sites. These programs aim to reduce the harms associated with injection drug use, including the risk of overdose and the spread of infectious diseases.
These are all such important initiatives. It's encouraging to see that progress is being made on the harm reduction front.
It's definitely a step in the right direction,
Yeah.
but there's still a lot of work to be done.
Right.
We need to continue to advocate for these types of programs and push for policies that prioritize public health over criminalization.
I couldn't agree more. It's clear that a multifaceted approach is needed to address this complex issue.
Absolutely. We need to be thinking about prevention, education, harm reduction, treatment, and recovery all at the same time.
Right.
It's not just about focusing on one aspect of the problem,
Yeah.
but addressing it holistically.
This has been an incredibly informative conversation so far,
It has been.
but it's also raised a lot of questions for me. I'm curious to delve deeper into some of the study's limitations and hear your expert opinions on what we need to be focusing on moving forward.
Sure.
Shall we pick up this discussion after a short break?
Let's dive right in. I think it's important to acknowledge that this study, while incredibly valuable, does have some limitations.
Sure.
One key point to remember is that it only looked at cases reported to poison centers.
Okay.
So the true scale of this problem could be even larger than what we're seeing in the data.
Right.
And another limitation is that the study didn't specifically address the motivations behind fentanyl use,
Right.
whether it was accidental ingestion or intentional misuse or abuse.
Okay.
Understanding the why behind these exposures is crucial for developing effective prevention and intervention strategies.
That's a really good point. It's one thing to know that fentanyl exposures are on the rise,
Right.
but it's another to understand the underlying factors driving that trend.
Exactly. And that's where more research is needed.
Yeah.
We need to dig deeper into the social and economic factors that contribute to fentanyl use,
Okay.
as well as the specific circumstances surrounding these exposures. For example, are there certain communities or populations that are at higher risk? Are there particular environmental factors that play a role?
Right.
These are all questions that need to be explored further.
That makes perfect sense. So given these limitations and the need for further research, what would you say are the most pressing priorities for tackling this problem right now? Where should we be focusing our efforts?
In my view, one of the most urgent needs is to improve data collection on non-fatal fentanyl exposures.
Okay.
Right now, we're relying heavily on mortality statistics,
Right.
which only tell part of the story.
Yeah.
We need a more nuanced understanding of the trends and risk factors involved,
Of course.
and that requires collecting more comprehensive data on all exposures, not just fatal ones.
That's a crucial point. If we're only looking at deaths, we're missing a huge part of the picture.
Exactly. And better data can lead to better prevention and intervention strategies.
So what are some specific actions we can take to address this data gap?
One important step is to encourage healthcare providers to report all suspected fentanyl exposures to poison control centers, even if they're not fatal.
Makes sense.
This will help to create a more accurate picture of the scope of the problem. We also need to invest in research that explores new and innovative ways to collect data on fentanyl exposures, perhaps through community-based surveillance or the use of technology.
Those are great ideas.
Yeah.
But beyond improving data collection, what other steps can we take to address the root causes of this crisis?
That's a big question, and there's no easy answer. But I think we need to start by acknowledging that this is a complex issue with multiple contributing factors. We can't simply focus on the substance itself.
Right.
We need to understand the social, economic, and environmental factors that create vulnerability to drug use. Things like poverty, trauma, mental health issues, and lack of access to healthcare all play a role.
It sounds like we need to be thinking more broadly about how to support communities and individuals who are struggling with these challenges.
Exactly. We need to create a more supportive and compassionate society that addresses the root causes of drug use rather than simply punishing people who use drugs.
That's a powerful message. So as we wrap up this part of our deep dive, I'd love to hear your thoughts on what our listeners can do to make a difference in their own communities.
Okay.
We've talked about the alarming statistics, the changing trends in fentanyl exposures, and the need for a multifaceted approach to address this crisis.
Right.
But what concrete actions can individuals take to protect themselves and their loved ones?
That's a great question. And the good news is there are many things that individuals can do to make a difference.
Okay.
First and foremost, we need to educate ourselves about the risks of fentanyl
Yeah.
and the signs of an opioid overdose.
Okay.
We also need to talk to our children, friends, and family members about the dangers of this drug and the importance of safe medication practices. And we can support organizations that are working on the front lines of this crisis, such as harm reduction programs and addiction treatment centers.
Those are all fantastic suggestions. And I think it's important to emphasize that this isn't just a problem for certain communities or demographics. It's a threat that transcends boundaries and affects us all.
It does.
We need to approach this issue with a sense of shared responsibility and a willingness to take action.
I completely agree. This is a public health crisis that demands our attention and action.
Well said. I think we've covered a lot of ground in this first part of our deep dives.
We have.
We've learned about the alarming rise of fentanyl exposures in children, the shifting trends in how these exposures are happening, the vital importance of safe medication practices, and the need for a multifaceted approach that includes prevention, education, harm reduction, and treatment. But we've only just scratched the surface of this complex and challenging issue.
There's certainly much more to explore.
Right. And as we move forward in our discussion, I'm particularly interested in delving deeper into some of the innovative harm reduction strategies that are being developed and implemented across the country. I'm also curious to hear your expert opinions on what we need to be prioritizing as a society to effectively combat this crisis. We'll delve into these topics and more in the next part of our deep dive. Stay tuned.
I look forward to it. You know, one thing that really struck me in the study was how the FDA's 2013 mandate to make fentanyl patches more viable actually seemed to have an impact.
Yeah.
The researchers found a significant decrease in dermal exposures after that change.
That's really encouraging to hear. It shows that even seemingly small regulatory changes can have a real impact on reducing harm. It reminds us that we need to constantly evaluate and adapt our strategies as the drug landscape shifts.
Exactly. And speaking of evolution, the fact that fentanyl is now being found in so many counterfeit pills is a real game changer.
Right.
It's not just about kids finding their parents' prescriptions anymore. It's about this hidden danger lurking in substances they might think are harmless.
It's scary how easy it is to be fooled by these counterfeit pills.
Yeah.
They're designed to look exactly like legitimate medications.
It's true. And that makes it even more crucial to talk to young people about the risks. They need to understand that just because a pill looks familiar doesn't mean it's safe.
It feels like a constant cat and mouse game. As soon as we catch up to one trend, another one emerges. How do we stay ahead of this curve?
That's the million-dollar question, isn't it? I
Yeah.
think a big part of the solution lies in recognizing the limitations of our current approaches.
Yeah.
For example, as we mentioned before, the study relied on data from poison centers, which might not capture the full extent of the problem.
So we need to find ways to gather more comprehensive data. But how do we do that?
It's not just about the quantity of data, but also the quality and the context. We need to dig deeper into the motivations behind drug use, the social networks involved, and the specific ways fentanyl is being used and distributed in different communities.
It sounds like we need a more holistic understanding of the problem. We can't just treat it as an isolated issue.
Exactly. We need to look at the bigger picture and consider all of the factors that contribute to this crisis.
That makes me think about the regional differences we were discussing earlier. There's clearly a lot of variation in how fentanyl is being used and distributed across the country. Do you think there are any lessons we can learn from regions that are having more success in tackling this problem?
Absolutely. There are some really innovative approaches being implemented in various parts of the country. One example that comes to mind is a program in some West Coast cities that's providing fentanyl testing strips to drug users.
Oh, interesting.
This allows them to check whether their drugs contain fentanyl, which can help them make more informed decisions about their use.
That's an incredibly proactive approach. It empowers people to take control of their own safety. Are there any other examples of programs that are showing promise?
Another interesting initiative is the use of mobile harm reduction units that bring services directly to people who use drugs. These units often provide things like naloxone distribution, needle exchange, wound care, and even referrals to treatment programs. It's about meeting people where they are and providing them with the support they need without judgment.
That's a really compassionate approach. It recognizes that people who use drugs are human beings who deserve care and support.
Exactly. And it's about recognizing that addiction is a health issue, not a moral failing. We need to shift our mindset from punishment to treatment and support.
It's amazing to see these innovative programs emerging, but I'm also wondering about the challenges of implementing these types of initiatives on a larger scale. What are some of the barriers that we need to overcome?
One of the biggest challenges is funding. Harm reduction programs are often underfunded and struggle to meet the needs of their communities. We need to advocate for increased funding for these vital services.
That makes sense. And what about the stigma surrounding drug use? It seems like that can be a major obstacle to getting people the help they need.
Stigma is absolutely a huge problem. It prevents people from seeking help and creates a culture of shame and silence. We need to work to dismantle the stigma surrounding drug use and create a more compassionate and supportive environment for people who are struggling.
It sounds like this requires a shift in our societal attitudes and beliefs about drug use.
It definitely does. We need to move away from the idea that addiction is a moral failing and recognize it for what it is, a chronic health condition that requires treatment and support.
That's a powerful message. And it reminds us that this is an issue that affects all of us, whether directly or indirectly. We all have a role to play in creating a more compassionate and supportive society for people who use drugs.
I couldn't agree more. And that brings us back to the importance of community involvement. This isn't just a problem for healthcare professionals and policymakers to solve. It requires the active participation of everyone.
Absolutely. Parents, educators, community leaders, we all have a responsibility to educate ourselves about the risks of fentanyl, to talk to our loved ones about the dangers of drug use, and to advocate for policies that prioritize harm reduction and treatment.
It's about creating a culture of care and support where people feel safe to seek help without fear of judgment.
And it's about recognizing that everyone deserves compassion and understanding, regardless of their struggles.
Well said. And I think that's a perfect note to end this part of our deep dive on. We've covered a lot of ground today, from the alarming statistics on fentanyl exposures in children to the importance of harm reduction and the need for a compassionate and holistic approach to addressing this crisis. But there's still much more to explore.
In the final part of our deep dive, we'll take a closer look at some of the cutting-edge research that's being done to develop new and innovative ways to prevent fentanyl exposures and treat addiction. We'll also discuss some of the policy changes that are needed to address this crisis on a systemic level. It's been a really thought-provoking conversation so far. We've talked about the heartbreaking reality of children being exposed to fentanyl, the challenges of staying ahead of the ever-evolving drug landscape, and the importance of a compassionate and multifaceted approach to tackling this crisis. But I'm curious to hear more about what's being done on the research front. Are there any promising new developments in terms of preventing fentanyl exposures or treating addiction?
There's definitely a lot of exciting research happening right now.
Yeah.
One area that's showing particular promise is the development of new medications to treat opioid use disorder.
Good.
These medications like buprenorphine and methadone have been shown to be highly effective in reducing cravings, preventing relapse, and helping people achieve long-term recovery.
I've heard about those medications, but I'm not really familiar with how they work. Could you explain a little bit about that?
Sure. Buprenorphine and methadone are both opioid agonists, which means they bind to the same receptors in the brain as opioids like heroin and fentanyl. But unlike those drugs, they don't produce the same intense euphoric effects or the same risk of overdoses. Instead, they help to stabilize the brain's chemistry and reduce cravings, making it easier for people to manage their addiction and focus on recovery.
That makes sense. So it's kind of like replacing a more dangerous drug with a safer, more controlled alternative.
Exactly. And the research on these medications is incredibly encouraging. Studies have consistently shown that they're highly effective in reducing opioid use, overdose deaths, and criminal activity associated with drug use.
That's amazing. So why aren't these medications more widely available? It seems like they could be a real game changer in addressing the opioid crisis.
Unfortunately, there are still a lot of barriers to accessing these medications. One major obstacle is the stigma surrounding addiction, which we've talked about before. Many people, including healthcare providers, still view addiction as a moral failing rather than a medical condition, and this can lead to reluctance to prescribe these medications.
That's really disheartening. It seems like we need to do a better job of educating both the public and healthcare providers about the effectiveness of these medications and the importance of treating addiction as a health issue.
Absolutely. And there are also systemic barriers to access, such as a shortage of qualified prescribers and restrictive regulations that make it difficult for people to get the treatment they need.
So even when these medications are available, there are still obstacles to overcome.
That's right. But there are also some really encouraging efforts underway to expand access to these medications. For example, some states have implemented programs that train primary care physicians to prescribe buprenorphine, making it more readily available in community settings. And there's a growing movement to integrate addiction treatment into mainstream healthcare, which could help to reduce stigma and improve access to care.
Those are all positive steps.
Yeah.
It sounds like we're moving in the right direction, but we still have a long way to go.
I think that's a fair assessment. This is a complex issue with no easy solutions, but I'm hopeful that with continued research advocacy and a commitment to compassionate care, we can make a real difference in the lives of people struggling with opioid use disorder.
I share your hope. It's been an incredibly insightful conversation, and I think our listeners will come away from this deep dive with a much deeper understanding of the fentanyl crisis and the urgent need for action. We've covered a lot of ground, from the alarming statistics on fentanyl exposures in children to the importance of harm reduction and the promising developments in addiction treatment. But before we wrap up, I'd like to circle back to something you mentioned earlier, the need for policy changes to address this crisis on a systemic level. What are some of the key policy areas that you think we need to be focusing on?
That's a crucial question. We've talked a lot about individual actions and community-based initiatives, but ultimately we need to address the underlying structural factors that contribute to the opioid crisis. And that requires policy change at the state, local, and federal levels. One key area is expanding access to treatment. We need to ensure that everyone who needs addiction treatment can get it regardless of their income insurance status or location. And that means investing in a robust network of treatment providers, including both inpatient and outpatient facilities, and making sure that these services are affordable and accessible to all.
That makes a lot of sense. We can't just expect people to pull themselves up by their bootstraps when they're struggling with addiction. They need access to the resources and support that will help them get better.
Exactly. And another important policy area is harm reduction. We need to shift away from the punitive approach to drug use that has dominated our society for so long and embrace a more compassionate and evidence-based approach that prioritizes public health and safety. That means implementing programs like needle exchange, supervised consumption sites, and fentanyl test strip distribution.
We've talked about those programs before, and it seems like there's a lot of evidence to support their effectiveness in reducing overdoses and other harms associated with drug use. But they often face significant opposition both from policymakers and the public.
That's true. There's still a lot of stigma and misinformation surrounding harm reduction, and that can make it difficult to implement these programs. But the research is clear harm reduction works. And we need to continue to advocate for these policies and educate the public about their benefits.
Absolutely. We need to change the narrative around drug use and shift from a place of judgment and punishment to one of compassion and understanding.
I couldn't agree more. And finally, we need to address the root causes of the opioid crisis. That means tackling issues like poverty, inequality, trauma, and mental health. These are complex and interconnected issues that require a multi-pronged approach involving investments in education, job training, affordable housing, and healthcare.
So it's not just about addressing the symptoms of the opioid crisis, but also addressing the underlying social and economic conditions that create vulnerability to drug use.
Exactly. We need to create a more just and equitable society where everyone has the opportunity to thrive. And that will require systemic change across multiple sectors.
It's a big task, but it's one that we can't afford to ignore. The opioid crisis is a public health emergency that demands our attention and action. And as we've discussed throughout this deep dive, there are many things that individuals, communities, and policymakers can do to make a difference.
You're absolutely right. This is a problem that we can solve if we work together with compassion, determination, and a commitment to evidence-based solutions.
Well, this has been a truly sobering yet also hopeful conversation. We've delved into the depths of the fentanyl crisis, exploring its devastating impacts on children and the urgent need for comprehensive solutions. But amidst the challenges, we've also uncovered inspiring stories of resilience, innovation, and a collective determination to make a difference. It's clear that this is a complex issue with no easy answers. But I believe that by fostering open dialogue, promoting evidence-based policies, and prioritizing compassion and understanding, we can create a future where every child can thrive free from the threat of fentanyl. Thank you for joining us on this crucial deep dive into the fentanyl crisis. And remember, knowledge is power. Let's use it to protect our communities and advocate for a brighter future for all.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.